Melanoma is the most aggressive form of skin cancer, arising from melanocytes. Unlike other skin cancers, melanoma has a high potential to spread to other organs if not caught early. It accounts for the majority of skin cancer-related deaths. Genetic mutations play a significant role in melanoma development. The BRAF mutation, found in about 50% of cases, leads to uncontrolled cell growth. Other mutations include NRAS and KIT, both of which contribute to tumor progression. Melanoma typically presents as an irregularly shaped, multicolored mole that changes over time. The ABCDE rule helps in identifying suspicious lesions: asymmetry, border irregularity, color variation, diameter over 6 mm, and evolving characteristics. Other symptoms may include itching, ulceration, or bleeding of the lesion. Ultraviolet, UV, radiation from excessive sun exposure and tanning beds is the primary risk factor, alongside genetic predisposition and fair skin. Diagnosis involves a thorough skin examination, followed by a biopsy of suspicious lesions. Histopathology confirms the diagnosis, with immunohistochemical markers such as S100, HMB45, and melanA helping to distinguish melanoma from other skin conditions. Further staging may require sentinel lymph node biopsy, imaging studies, and molecular testing for targeted therapy. Treatment depends on the stage of the disease. Early-stage melanoma is treated with surgical excision. Advanced cases may require targeted therapies, such as BRAF and MEK inhibitors for BRAF-mutated melanomas, or immunotherapy using checkpoint inhibitors like pembrolizumab or nivolumab, which help the immune system attack cancer cells. Chemotherapy is less effective but may be considered in refractory cases. The prognosis of melanoma varies by stage. When detected early, the 5-year survival rate exceeds 90%. However, metastatic melanoma has a significantly lower survival rate, emphasizing the importance of prevention and early screening. To protect against melanoma, individuals should practice sun safety. Regular skin checks and awareness of changes in moles can aid in early detection. Thank you.